This is a Change Physician, episode 176. Welcome back to the Change Physician podcast. I am Melissa Cady, the Challenge Doctor, with my co-host, Dr. Kevin Cuccaro, following up some awesome episodes with Tim Creasey, who we had interviewed. Of course, he's a returning guest and had talked to us. He's from ProSci and talks a lot about change. And he had originally talked with us last year, I guess, right, Kevin? It was 2021. He talked about the ADKAR method. If you didn't watch that, I'm not going to explain exactly what that is. You can go back and watch that episode, but there are different elements that are required for effective and successful change. This time around, we talked in more specificity about alignment hacks. And of course, the most important thing was the good question you asked him, Kevin, was what the heck is alignment? And thank God I was listening to the context of your conversation and you brought up Dungeons and Dragons, because when you said D&D, I had no idea what you're talking about. I think I was living in a dungeon.
Yeah. Well, so just to kind of reflect back, so Tim was back in episode 136, which was October 10th when he came on with that, the ADKAR method, and definitely would be a good thing to start with, because with ADKAR, you get kind of these steps of behavioral change. And then these, when we're talking about alignment shifts and very specific, is to make sure that alignment is this shared perspective taking, because you can't institute change if you can't communicate effectively. And so that's what I really took away with, was how important frames of reference and perspective is when it comes to communication. And we hear about, we always hear things about what's people's background, and we're certainly getting a different perspective on ethnicity and race. And we know that there's different perspectives. And I think over the last couple of years, there's a lot more awareness about that. But just in individual communication, the fact that you have to be, I almost always envision like there's this plane, right? So I'm here and you're here. And if we're here, then we're communicating effectively. But so much of the time it's like this or like that, and so these alignment hacks is then making sure that we're here. So fun episode. And I always like talking to Tim because he's always got good thoughts.
Yeah. And he dives deep in a lot of things. I always like when he said this last time too, and that reality, a lot of times people say,
perception is
reality is just perception. And he's like, well, perception is really your reality. And that's so true. Even with the last couple of years. Your reality is your perception, and it is your reality, like the reality you live in. And so I could see how it's hard for people to change in general, when even if people are trying to educate them on how people's lives are different and trying to give them a different perspective, some people might be stuck in that reality that some people won't ever, because they don't have a willingness or whatever the reasons are. But I find it fascinating.
Well, and I think one of the, if people listen to these episodes, again, that was 136 in these last two, I think what you start realizing is that what you think is true and real, whatever that may be, is not the same for everyone. And so when you're saying this is what things are, and that's just how it is, and I don't need to change, you're not recognizing the fact that we are completely different humans with the same word to a different person can mean completely different things, can completely change the conversation. Like the example, the alignment, right? He says alignment hacks. That context that I have is from my youth, where I spent a lot of time playing Dungeons and Dragons with my friends. And alignment was this basically your morals and ethics of what your character did or wasn't supposed to do. Like, and there was this whole little diagram between law and chaos and good and evil. And so that word, every time I hear it, is always loaded for me. And that matters. And if you're in a forward-facing profession, everybody in medicine is, and if you're if you're a family practice and you're seeing everybody, if you are in pathology and maybe you're talking predominantly to other physicians, you still need to make sure that your definitions are the same, that you're using that when you're using a word, it has the same shared meaning in order to transmit or effectively communicate to somebody else. So, so many things in there that we could have just kept going on and on and on about. yeah, I don't know. Was there any other specific things that you want to talk about? Otherwise, I'll pull out some more.
Yeah, no, I wanted to kind of bring full circle. Our last few episodes have been about relationships, and it just makes you realize how tremendously important and challenging, and why, partnerships or marriages can be so much work. Is there's the realities of each individual are in some ways separate. You're trying to keep them merged in some way, like a Venn diagram of some sort, where you're overlapped enough where you have a shared reality and that you understand each other. And there's just so many elements to it. I couldn't help but like throw that in, because I think, like he said, these alignment hacks and trying to, implement change or to communicate, they're relevant for all kinds of, relationships.
In that longitude, we didn't necessarily talk about that much, that longitude of the relationship, except when he used the example of I think it was his sister and brother-in-law, or his brother and sister-in-law. I couldn't remember exactly how they were related, and how they have all these shared experiences. And because of those shared experiences, their communication has changed. It's much more efficient in regard to the taboo game. And I'm thinking, well, you can apply this in the same way to physicians versus your patients. Physicians, by the commonality of our training, have a shared language. And because of those experiences, and then you can even continue to deepen it as you progress into residency or fellowship training, you have lengthened that shared version. So you have a greater depth and a great shared meaning for the word. So to communicating to someone who's in the same specialty of you is so much easier than speaking to somebody who's not. And so I guess if the listeners are going, what are you talking about? Why is it important about that? Well, how easy is it when you talk to your partner about some important case of the day, or the pathology, or the procedure, or how the treatment went? It's easy, right? It doesn't take a lot of time, unless it's, if it's a complex case, then you're talking about the complexity of the case, but you're not necessarily trying to figure out the words. Now, imagine you're trying to take that conversation with your patient, though, and it's a whole different ballgame. So how then, the more that you can learn to take these informations and to kind of create common frames of reference, and that comes from your own, as well as recognizing, trying to figure out where that person that is, what their frame of reference is, these alignment hacks that Tim was talking about, it should enable you to actually transmit and provide better care with your patients. So, and we barely touched on this stuff, if at all, in medical school. Like, maybe they're doing it more, but this is so important to the field when you have so much important communication like we do in medicine.
Yeah. And this just popped in my head, is just thinking about trying to help, even if you're trying to help someone understand what it's like to be doing the job you do, or as a physician and trying to communicate with a non-medical person, or your spouse who's not in medicine, and your reality is not the shared reality, really, from at least your career. They can try to understand, but just like anything else, you don't truly understand what someone's going through or what things are like unless you do it yourself, unless it's very well communicated. It's a good example during the pandemic. Like, there's not a shared reality between the ICU nurse that's pronounced 4 people dead versus the person that doesn't believe that COVID's real. Like, that reality is distinctly different. And I know I'm going off on a tangent, but it just goes to show you how divergent our realities can be, and how hard it can be sometimes to communicate. Sorry,
just so hard. Yeah. No, I completely agree. And the other thing that he said that I really, really enjoyed, was like, we're trying to beam ideas. And I think a lot of people think that that's what communication is, because I said the words, the magical transporter beam of ideas has transmitted the idea from my brain into your brain.
Planted the seed.
And just like Star Trek, it made the little idea there perfectly there. And that is so not the case of what occurs. We wish we had this ideal transporter beam, but instead, again, I'm going to show my geekiness here. It's going to be like this horrible scene in the very, very first Star Trek movie that horrified me as a kid to see, where the the beam malfunctioned. And so it beamed up their science team or someone, and they were all this malformed, goopy, globby thing. It was so horrible. It totally traumatized me as a kid.
Oh, no.
But that was the other thing I saw. I was like, yeah, that's where we're trying to transport ideas, and instead what we're getting is we're sitting this gloppy, weird, malformed mess in people's brains. Anyway, that's a pretty ugly view of communication,
Well,
but it's true.
How about, linear versus emergent? It's not a very linear process, just like the delivery of information. It's precisely what you sent out. It's an emergent phenomenon, and people may not know what I'm saying when I mean that, but
so then define the context then. So you need to then define those terms. So
this is an example of us. So essentially there are things that, like the examples I know that you probably used even on your presentations, like traffic isn't necessarily one thing or one car that caused it. And it could kind of be something that incites it, but there are something, or weather, like it's not always just one thing that leads to, A leads to B. It could be A, B, C, D, E, F, and G that come together and synergistically or together create a phenomenon that is not really, it's not something you could totally predict how it's going to really turn out based on so many variables. So those variables for someone receiving a message, like me saying, like eat healthy, their interpretation might be, I just need to eat food that's not in a package, or, although I'm trying to say eat more greens and maybe lean meats or no meats or whatever people's perception is, but eating clean, of course, what's that mean too?
Yeah, what does that mean?
So you have to define everything. And so people's interpretation based on how they were raised, what their parents said was a good healthy meal, meaning eat everything on your plate. I mean, there's so many things that can create a different context in your mind as to the information you're hearing from like a physician. So the patient has an emergent phenomenon, essentially creating a new, how would I say this? So you say something real simple, but it's real nebulous, and then like eat healthy. And you're trying to construct based on what you've known in the past that obviously maybe have led to the patterns that led to problems, which is why this physicians tell you to eat healthy. And so you come up with a totally different, interpretation of what they said. You want to frame that better for me?
Well, I think I would move it back to the realm of filters and lenses, right?
Okay.
So all these past experiences that you have, these previous experiences provide different frames of references, and different words have different meanings for you. So if eating clean, like you said, if you were from a family and they said clean your plate, so clean has this very real, very true, very very defined meaning of you clean your plate, right? So if someone says eating clean now, that then filters through those past experiences such that when you hear that word, you're thinking, I need to finish what's on my plate. And when you would say, yeah, I eat clean. So, I kind of view communication in a lot more of filters and lenses of what you have to, if you have never been exposed to a word or concept and it's brand new, it's essentially meaningless, right? Because it doesn't have anything to anchor it on. So in now that scenario, what we do is then we will anchor this new word to a previous experience or something that we know. So that's one of the reasons that analogies are like so crucial to communication, is they provide us to say, this is like, this is a garnet. It is a precious stone, like I don't know, a ruby. I'm not sure. But I know what chicken. Yeah, like chicken, like everything tastes like chicken, right? So, but we have this comparator that we're trying to link it to, and so much of communication, and particularly as we get educated, we have a greater depth and we have a more surgical precision with the words that we use, that we tend to forget that other people don't know. And so I think that's the crucial thing about really when we're talking about Tim, and we're talking to Tim and talking about alignment change or alignment hacks and behavioral change, is this recognition of where these frames of reference are, and what you say and you think you say, and it is in no way or shape or form exactly what the other person hears. And the only way you're going to hear that is to hear what they're reflecting back. That was the one thing I'll add that conversation, though, is how do you recognize when you're misaligned? So there really is two keys to that. Is in Timson, there's, when you both know you're not on the same page, when you're both on the same page, and then what was the other one, is when you think you're on the same page, or you think you're not on the same page, but you actually are. But it's when you both think you're on the same page, or you both think you're not on the same, or you both think you're on the same page, or you both think you're not on the same page and you're not. That's super hard. Like, how do you recognize that? Like, either if you are not being actively aware, that's total miscommunication, and it's the worst type of miscommunication in my book, because there's without the awareness, which is like it's like the subtitle of our podcast, I guess. Without that awareness that there's a misalignment, that communication is going to go unaddressed, unchanged, and God knows what it's going to end up as, right? Because it can't be corrected until it's already caused or festered somewhere, because nobody was aware of it. So that's kind of the thing to me, is how do we become more aware of when we're misaligned, when our alignment isn't aligned? And I think that's kind of the name of the game to me.
Yeah, you would think it would require multiple reassessments, and what the patient says in return, or what they do over that short term or long term, depending on what that thing is that you're on the page with.
I think they do that with there's some strategies I think they're teaching now, like teach back, but I still think that's like the name of the game. If you become more aware of when you are imperfectly communicating, then you can potentially address and correct it.
Yeah. I also find that even in my own consultations, I will at least 3 times ask, do you have any, other questions, versus I want them to feel comfortable to ask questions, is what I'm trying to create. And if I just do it once when I'm trying to rush off or something like that, it doesn't work. I try to do it on at least three times. And then, but they're in different situations, different kinds of medical specialties. I mean, there's different ways that you might want to ask back. I don't know how to phrase it. It always comes out in my conversation when I ask it. I'm trying to think of how I would poise it. But are
you asking more open-ended than closed-ended questions? I think would be a big one.
Yeah, that and just I try to say it in non-medical language, but I might reference a medical term so that they understand it when they see it, because people might be saying it around them. I'll ask, what does that mean to you?
That's a great question.
Yeah. So it's one of the most fascinating answers that I can get sometimes, because then I'm like, holy crap. I had no idea that they were thinking that. Yeah. And if you don't address that, I mean, that's what's going to tailor your next move on the conversation too.
Well, that's kind of the crux of communication,
right?
Is the meaning.
Right.
So I like that question, because you're basically just like, you're scorching and pulling it out. Is what does that mean to you?
Right.
Well, this means this to me. Like a simple example, alignment hacks. Hey, Kevin, what does alignment mean to you? Well, I got to say, alignment means this because of blah, 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 blah. Oh, I never, I don't have that experience. That's not, but what I'm meaning is actually alignment, where we're actually realigning our frames of reference so that we're speaking on the same terms. Does that make sense to you? Well, yes, that does. Well, now we're in alignment, right? So I love that, that what does that mean to you? And it's so powerful in medicine, because there are so many different meanings that are particularly important to the patient, that are context important to the patient, that we may not be aware of unless we specifically ask.
Right. And another example is that I think of, especially if a physician has a patient in front of them that, whether they're having surgery or something that they might be fearful, or cancer, anything at all that elicits any potential fear or anxiety, especially if you sense it off of them, the whole sympathetic response, you can see the eyes are the shifting. But I literally will ask, is like right off the top. And when I send like a little video to tell them the things that I can tell, usually because of the experience, you realize the things that you say that are triggers for patients that might make them fearful or anxious. I go ahead and put them in the video so they've already gotten through that initial phase. And then when I start talking to them later on or during our consult, I'll just say, first I specify what's going to happen during, I'm make sure I know your medical history. And I want to make sure I answer any of your questions, whether it's from the video or anything we discuss. And so when I ask the question specifically, I say, are there any particular concerns or fears that you have in particular? And the reason I like to ask that at the beginning is because you know that your brain is busy being nervous and worried or wanting to make sure you ask a certain question. And so you're not really hearing the physician talking to you. At least that's my perception, is that they can't really clear their mind until they get that off their chest. So I kind of trying to get them it helps me understand where they're at and what I need to address.
And that clarifies, and I think that would also be super useful to alignment as well. Yeah, at least again, to provide alignment or a level of awareness of where you are. Is there anything specific about, if you're doing whatever, is there any specific about this procedure? Is there any specific about the diagnosis? Is there any specific about this visit today that you are concerned about? Mm-hmm. Being a super powerful one to kind of figure out where people are coming from. Yep. Just remind me, actually, I needed to talk to my wife about that because we were just talking about people coming in, with multiple lists of things. And so often that it's not what the nurses charted on the little patient encounter. That it isn't it, and she's like, oh, they're doing this, and I'm going to come back with that question again because how important that is. Is there any specific today that really, really is concerned about, and maybe something completely not that's on the piece of paper, right? And I think we've always learned that's usually what the door handle thing is when you're walking out the door and they're like, oh, but wait, well, yes. How can we elicit that key entity earlier on so that we can actually make it a more effective patient encounter?
Right. And that's more patient-centered care, essentially.
So let's flip it on the patient side, because I know we have some people who are non-physicians. And so if you are then in an encounter and kind of thinking this ways of how do you align or figure out where your physician is coming from to where your frame of reference is, one of the things that you can specifically then do is be very clear on why you're seeing your doctor. Mm-hmm. What specifically are you seeing them for? Why is that important to you? And then how would that visit be? What kind of effective information would be useful to you at that visit? And if you can, that's the other thing is sometimes I think people think that a encounter with your physician has to be this passive game where you walk in and say, well, my elbow hurts and that's it. You have so much more power as a patient if you go in with a little bit of specificity. I'm not talking about Google lists where you Googled, elbow pain and it came with 65. I mean, most of those questions, I read those things and I'm like, this is the stupidest article. Who wrote this? Here's 42 questions to ask your doctor about. No, you don't do that.
Yeah.
I'm coming in specifically with that elbow pain. Why am I concerned about this? Well, because I was playing tennis or whatever and da. How is this relevant to my, the what, why, the who, what, when, where, whys, and hows of I think they use it for journalistic structure. Like it's the interrogate. There's a word for them. Then common interrogators: who, what, when, where, why, and how. And I always kind of use those to frame specific questions. But if you're very specific about your problem, and at least tell the meaning of what that problem is, and maybe a little bit of expectation about what you're hoping to gain, it will make your physician's job so much easier to address that problem. And more importantly, they're going to know how important it is to you.
Right.
Versus saying, oh, that's nothing. You got a tennis elbow. Well, if I was a tennis star, that may be a big deal. Or if that's a piece of my identity, that may be a big deal. And I may have not a clue what tennis elbow is. Instead, I Googled it and someone tells you you're going to have your elbow's going to rot off in 10 years if no one does, a lot of the stupid stuff that they put online. But
yeah, that passive stuff, I think you don't have to be a jerk about it. You literally can just go in and just say, hey, this happened. I just want you to know I'm really concerned about, in fact, I have a 3-year-old and I'm trying to manage this and this in life, and I feel like I can't be a like a little bit of insight as to most people go to the physician because most of the time, it's not just because I was told to. It's usually I'm worried about something for a reason, or I'm, basically anxious or worried about something. And so I think if you just delineate that a little bit with a little detail as to why, then the physician can, of course, they'll ask you your little who, what, why, when, all these things just to kind of, figure out some things, but they can tailor it to your concern so that it's addressed appropriately. So if you're saying you're fearful you're going to die because of your back pain versus just going and saying I have back pain and they say, oh, there's nothing wrong, memorize normal, or the other way around. But anyway.
I have back pain. I'm scared because my grandpa had back pain and died of a spine tumor.
Yeah.
Well, that's a very different, and if you knew that in advance, you wouldn't be saying, well, what you need to do is rest. And as long as you do gentle movement, we haven't actually solved the problem for them.
Yeah. But I mean, that's the thing. It's like sometimes people will do imaging more just to rule out that big fear of your grandfather. Most time they say you don't need to do that, but usually some other symptoms involved, but at least they can address it in the context of your concern.
So right? I'm just looking at the alignment hacks that Tim has sent over. I'm trying to think, okay, what are we talking about? I guess this one, so much of what really comes down is, again, to what end, where shared understanding on what we are trying to achieve and the desired outcome of effort. And he mentioned that, but I do think that is really, really critical. And that's a lot of what we're talking about now when we're talking about patient encounters.
Yeah, to alleviate fear. To
alleviate fear and to promote a better interaction. Figuring out what the end is. Anyway, so I kind of think we can talk about this forever too.
Yeah. Well, I'm looking forward to, I know we talked about in the future, there's some other focuses or foci or foci, whatever plural
focuses
is
versus foci.
Foci. And looking forward to actually tying it into a lot of our physician experiences too. So you want to take us out?
Sure. Well, thank you all for joining us on the Change Physician podcast. We're doing a deep dive episode. And deep meaning we're going deeper into our shared understanding of our episode with Mr. Tim Creasey of ProSci, where we talk about alignment hacks. And as always, if you're interested in the community, you can join us at thechangephysician.com, whether you're a physician or a physician ally. And until next time, stay well.
Take care.